continue with the second part of anxiety disorders for behavioral science and psychiatry for Falcon Physician Reviews. Our next anxiety disorder will be post-traumatic stress disorder. So post-traumatic stress disorder, or PTSD, occurs after a threatening event that causes fear, hopelessness, helplessness, and a fear that the person was actually going to die or be killed, or fearful of their body, something bad was going to happen to their body. And frequent examples of this are going to be rape, some kind of trauma, a childhood abuse, an accident, for men who are in war, battle experiences. And they have increased anxiety due to persistent re-experiencing of the event. They try to avoid remembering the event, and they have hypervigilance or increased arousal. Those three things must be present in order to diagnose post-traumatic stress disorder. If you have this kind of symptoms for less than 1 month, it is called acute stress disorder. Within the first month of the trauma, if you have these illnesses, it is acute stress disorder. And this is an important USMLE point because you need to know the time periods. But if it is longer than 1 month, it then becomes post-traumatic stress disorder. Post-traumatic stress disorder can occur at any age. The prevalence of PTSD for men is actually 6 to 8%, and for women it is 13 to 15%, and an average of about 8% in both of the populations. The symptoms may take place at any time following the event. Make sure that you differentiate post-traumatic stress disorder from any other kinds of anxiety, panic disorder, obsessive-compulsive disorder, and dissociative disorder, which can all have similar symptoms. Not everyone that has trauma develops PTSD, and we're not exactly sure why, but they have noticed that patients with reduced hippocampal volumes have an increased risk of post-traumatic stress disorders, as well as certain personality traits, the amount of resiliency you have, and if you've had multiple repeated traumas, you have an increased risk of having post-traumatic stress disorder. So what are you looking for in a person with post-traumatic stress disorder on your exam? There will be an obvious trauma where the person thought their life was in danger, and they will have nightmares, flashbacks. So that's part of their re-experiencing. They will try to avoid anything that makes them remember the incident. So for example, if a person was raped behind a Chinese restaurant, every single time she smells Chinese food, she becomes very tearful, very fearful that it might happen again. So she avoids it altogether. It prevents her from remembering the event. And someone that is having a lot of hyperarousal or hypervigilance, so that they're constantly watching their back. They jump when people tap them on their shoulders. So these are the three main symptoms that you'll see in a person with post-traumatic stress disorder. They may also have some survivor guilt. How do you treat these patients? Counseling, therapy is very important. Group therapy is also very helpful. Tricyclics, serotonin reuptake inhibitors, and other antidepressants have been shown to help, especially because these guys frequently have a comorbid depressive episode. Next, we'll talk about generalized anxiety disorder. And generalized anxiety disorder is a pervasive, poorly controlled anxiety regarding most every aspect of life that manifests itself with both psychological and physiological symptoms. So the anxiety must be present for at least 6 months. Now, this is not an anxiety like, I have an exam, I feel anxious about it. Or this is not an anxiety about, I just sent my new daughter to daycare and I feel worried about what she's like. Generalized anxiety is anxiety about almost everything. Oh, I accidentally cut that guy off when I was driving. Oh my God, I feel so bad. What am I going to do? Or, oh, I don't think I said the right thing to that person today. Or, oh, what about my finances? Well, what about my school? It's constant. Every single thing is, they're very worried about everything. So it's not about a specific thing. And these patients usually present in their 20s, and their lifetime prevalence is about 5%, with slightly more female predominance. Not about one specific factor, usually pervasive throughout their life, must last about 6 months. So what you're going to look for is a young female who's a worrywart, who's irritable, she can't pay attention, She can't sleep at night because she has a hard time falling asleep because she can't get herself to slow down because she's constantly worried about, what am I going to do tomorrow? And usually there is substance abuse as well. These patients will also have increased muscle tension in their presentation. How do you manage generalized anxiety disorder? Behavioral psychotherapy, including biofeedback and relaxation techniques, are helpful, as well as using SSRIs, benzodiazepines, and buspirone. Anxiety associated with a general medical condition. Cardiovascular and respiratory conditions that can mimic anxiety include asthma. People are having difficulty breathing, so it might look like they're having a panic attack. Cardiac arrhythmias, again, with your heart beating very fast, you get sounds like you're having a panic attack and you're very nervous. Hyperventilation syndrome. Hyperdynamic beta-adrenergic states. So these are common symptoms that look like you're having a panic attack or that you're looking very anxious. Mitral valve prolapse is commonly found in patients with panic disorder. Endocrine, look for things like hyperthyroidism, hypothyroidism, Cushing syndrome, adding steroids to a person's treatment. Those are very important medical conditions or endocrine medical conditions that are associated with anxiety. Neurological conditions, multiple sclerosis, collagen vascular disease, epilepsy are very common causes of anxiety due to general medical condition. Substance-related anxiety. So if you get intoxicated with caffeine, cocaine, sympathomimetics, and anticholinergics, you can look kind of shaky and jerky and look like you're having an anxiety attack or looking very anxious. Withdrawal from alcohol, opioids, and sedative hypnotics, which generally when you are intoxicated with them makes you look very sleepy, but when you start withdrawing from them, the alcoholic tremors and the same with sedative hypnotics can look very much like alcohol withdrawal, where your tremors, your heart's beating really fast, your blood pressure is elevated. These all very much look like anxiety. So you must rule those out before you diagnose an anxiety disorder. How do you treat anxiety? There are some behavioral methods that you can do. First, good sleep hygiene and stress management. Only take on activities that you can handle. You can learn to say no to other people. Decrease caffeine and nicotine, because those substances can make you look very anxious and can actually make anxiety worse. Nowadays, people are drinking lots of Red Bulls and Monster drinks. Make sure they're not drinking those drinks as well. Relaxation training. What is relaxation training? This is where you learn the patient to slowly relax all the different muscles in their body over a period of 10 to 15 minutes. And they'll learn that when they get in a stressful situation, that if they can slow themselves down, they can think more logically about it. Desensitization and exposure treatment, exposure response preventions, and cognitive interventions are helpful as well. Medications. Antidepressants are very helpful. In obsessive-compulsive patients, you need to use very high doses of antidepressant doses. And in anxiety patients, you must always remember to titrate the medication very slowly, because when you first start an antidepressant, it can cause some increased irritability and anxiety because of the medication getting used to your system. And so if you start them very slowly, then you can prevent these symptoms. But if you were to give a medication to a patient which increases their anxiety, they're not going to take it. So always go slowly with these medications. You can use anxiolytic medications such as benzodiazepines. Beta blockers are also very helpful in social phobia. So for example, you have someone who only has a phobia when he goes up and speaks in front of an audience. But he only has to do that once every 6 months. So this is a patient that you probably don't want to give an SSRI to because they're having such few attacks. And a beta blocker, what it will do is decrease your sympathetic response. So it won't cause the elevation in your pulse, it won't cause your blood pressure to go up, it'll decrease your sweating, kind of helps you decrease that autonomic response. So many medications can be used for anxiolysis. Benzodiazepines are very helpful acutely and they work very fast. But SSRIs and the other antidepressants are the mainstay for treatment of chronic anxiety disorders. Buspar, which has been mentioned, or buspirone, which has been mentioned several times in this lecture, is a non-benzodiazepine partial 5-HT1A agonist. And it's really used for generalized anxiety disorder. It doesn't work quickly like the benzodiazepines do, so it wouldn't be helpful for panic disorder. And the good thing about buspirone is that it doesn't have any abuse potential, and it generally doesn't have very many side effects, so it's very safe to use. So benzodiazepines, how do they work? Well, they work on the inhibitory CNS neurotransmitter GABA. And again, that makes sense because when someone is excited or anxious, they have a lot of increased autonomic response, their thoughts are going really fast, they're in like the excited state. So a medication that increases your GABA makes sense because this slows the person down. And these medications are good because if you have a patient with severe anxiety, you want to put them on an SSRI, but you know it's going to take a really long time to work, start them on a benzodiazepine and help them with their symptoms. And once the SSRI helps, you can slowly taper away the benzodiazepine. And here on your slides, you will see a list of common benzodiazepine medications. Clonazepam, which is a long-acting medication, is a good medication to use for anxiety because it has a longer half-life. It doesn't give you that immediate high that some of the short-acting benzodiazepines can give you, and so there's less abuse potential. Several of the antidepressants and buspirone are approved for the treatment of anxiety disorders. Again, though, sometimes they take too long to work, so that's when the benzodiazepines are added. Benzos are generally safe. You must remember to remind the patients that if they take benzodiazepines on a regular basis, that they cannot abruptly stop them, because if they were to abruptly stop them, it can result in withdrawal symptoms such as seizures, even coma, and even death. It's pretty deadly to stop a benzodiazepine if you've been using them for a long period of time suddenly. Also, you don't want to use a benzodiazepine with alcohol because it can cause an increased sedating action and can be fatal. Watch out also for a disinhibition sometimes seen with benzodiazepines in the elderly and children. And also with the elderly, you want to be careful with using a benzodiazepine because it can cause memory impairments and it also can provoke falls. What are side effects and adverse reactions for benzodiazepines? The main side effect you're going to get is the insomnia. And also remember to watch out for withdrawal reactions if they suddenly discontinue. Buspirone is again, 5-HT1A receptor agonist. It takes several weeks to work and has very little side effects and has no withdrawal syndromes. So this is the end of anxiety disorders for behavioral science and psychiatry for Falcon Physician Reviews. So this is the end of anxiety disorders for behavioral science and psychiatry for Falcon Physician Reviews.